There are still a lot of questions tonight about the Omicron variant. Joining us now to try and answer some of those questions is Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Doctor, thank you so much for joining us. Is Omicron as dangerous as Delta?
Well, we don't know. And there are two parts of dangerous that I always sort of think about. One is it spread more easily and infect more people? That makes it dangerous. There is some evidence that it does seem to be spreading more easily. And then the second is, does it cause more severe disease? And that we just don't have any data on yet at all.
Scientists are calling this the Frankenstein of all variants. Is that misleading or overly alarmist?
I think it's a little alarmist. Look, it does have a lot of mutations. Number of mutations isn't the big issue. The big question in our minds is it going to make our vaccines less effective? Is it going to make it more dangerous? We just don't know right now. There are concerning features of this variant that have many of us looking more carefully. But I think there's no reason for people to overreact and feel like somehow this is a game changer. It may very well not be.
What if we find out that our vaccines that we currently have are maybe only 50% effective? What happens then?
Yeah, that's a really good question. I think that is a possibility that we could see a hit to the effectiveness of the vaccines. And then that will mean, then of course, the other part of the question will be then what about severe illness of people who are having breakthrough infections? Are they getting significantly sick? If not, then I think we're in good shape. I do think we will need to probably build a variant-specific vaccine, a vaccine particularly against this variant.
And so what additional measures should we take now heading into the holiday season?
The single biggest thing is people need to be vaccinated. With this highly contagious variant out there, it's very dangerous time not to be vaccinated. If you are vaccinated but have not gotten boosted, I think there's plenty of reasons to think that boosted people will do much, much better. Other than that, I don't think we need to be doing anything else significant. I continue to wear a mask in crowded indoor settings and avoiding large crowds. Those are good pieces of advice in the middle of this pandemic altogether. I don't think that changes for this specific variant.
Dr. Jha, it feels like every time that it seems like we're rounding the corner on COVID-19, something else pops up or a new variant pops up. What do you say to Americans who say, are we back to square one?
No, we are not back to square one. We are in a very different position than where we were in March of 2020. Even if our vaccines take a hit, they will not be totally ineffective. We have great tests that can identify this variant. We've got therapies now. We also know how the virus spreads, and we have lots of tools for preventing spread. So we're in a much, much better place, not where I'd like to be. I'd like for this pandemic to be behind us, but that's not what we have as an option. But we are in a much better place than where we were.
Dr. Jha, thank you so much for your time and your expertise.